Hello, today I'm going to be talking about the otoscope. So the otoscope is used for the nose, the ear, and the mouth, and I'm going to talk about them in that order. So when it comes to the nose, you want to check the septum, make sure it's not fractured at all. So after this, you would push up on their nose, but if it's fractured, you could have them go like this, and it opens the nasal canal still. So when you do this, you want to put the otoscope into their nose, and you want to check out their septum still, because it still might be fractured, that you just couldn't palpate it. You want to make sure there's no obvious deformities like a laceration. You want to make sure there's no cerebral spinal fluid, no blood, and that you need to check the turbinates as well. Make sure there's nothing going on there. Next, you want to go to the ear, and for the ear, you need to have the largest speculum on the otoscope, and you need to check the outside of the ear to make sure there's no auricle hematoma, no lacerations, any serious problems there. Then you would pull the ear superiorly and posteriorly on a 45-degree angle, and that opens up the ear canal for you to put the otoscope through. When you put the otoscope through, like I said before, it needs to have the largest speculum on it, and when you put it in the ear, it has to go just past the protective hairs. Some patients might be fearful. They might jump. You need to be prepared for that because you don't want to cause them any extra pain. So be aware that that could happen. The tympanic membrane is what you're really going to be looking at. Yes, you need to make sure there's no blood, no cerebral spinal fluid, no lacerations inside the ear, but the tympanic membrane should be like a grayish color, and pink is okay, but when it's red, that means there's an infection. So next, we're going to talk about the mouth. When you do the mouth, you want to first palpate the lymph and parotid gland. Then you're going to check the vermilion border, which is where the skin and the lip meet. After that, you're going to have the patient open the mouth. You're going to examine their teeth, their gums, their jaw, tongue, their palate, their tonsils, their uvula, and you want to make sure that there's nothing going on there. You don't want their tonsils or uvula being red, because that means that it's irritated and that there's something going on. And this can be like pharyngitis, anything like that. Thank you.